Assalamu alaikum doctors, myself Mohammad Asim Hussain working as product manager in Genix Pharmaceutical. Dear doctors, welcome in webinar session on behalf of Genix Pharmaceutical Management. Genix Pharma was founded in the year 2004. We have a vision to help and provide top quality and affordable medicine for all those in need. Genix is being on the fastest growing company in Pakistan pharmaceutical arena. We remain committed to improving of life of pupils associated with us at all level because we are dedicated to good health. Today our session is a part of educational activity and presentation topic is very different, that is pregabalin, anxiolytic and neuropathic pain management. Guidelines and consideration presented by well-known legendary consultant neurologist Dr. Bashir Ahmed Soomro. Dr. Bashir Ahmed Soomro is head of Department of Neurology and Neurophysiology in Dr. Zia-ud-din Hospital, Karachi. He is professionally very busy person and always available for education. Thank you so much, sir, to join us. Dear doctors, if there is any question, please drop your question in chat box. Question answer session will be after presentation. Over to you, sir.
Thank you very much, Asim. It is being a pleasure with you and the Genix Pharma as an educational activity for the Train the Trainer program, which we have started. And this is my third lecture, which I am presenting with the trainers and training program. And the pregabalin is a molecule which is very commonly used by the neurologists, by psychiatrists, and by general practitioners. So basically, the role of pregabalin is important to discuss because uses and misuses can lead to the side effect profile of the pregabalin, and it can harm the patients also. So the pregabalin has a very comprehensive role. When it was launched in UK and FDA approved 2004, it was having a clear-cut indications. It was launched as an anti-epileptic medication, and simultaneously it was known that this is a very good for the pain management also. And by the time it passes, it has been noted that this has a property of anxiolytic also. They compared the head to head with the benzodiazepines. So it has a multifactorial indications, which I am going to discuss with the presentations in my presentation. And there are few guidelines and recommendations by the European and American guidelines. So the disclosure is this presentation is sponsored by Genix Pharma for the educational purposes of the Train the Trainer program. And the key instrumental in this presentation is the Asim Hussain and Akil Haider. And the Akil and they have both have a desire to educate the public regarding as a commercial institute, but they have a simultaneously both responsibility as a corporate for education as well as for the welfare of the patients. So this presentation is sponsored by Genix Pharma. Thank you, Genix Pharma. So pregabalin is a medication that is commonly used for the treatment of epilepsy, anxiety disorders, and neuropathic pains. And it is known as an anticonvulsant medication or anti-seizure medication. And pregabalin works in different ways. In epilepsy, it stops seizures by reducing the abnormal electrical activity in the brain. In the nerve, it blocks the pain messages to the brain and from spinal cord to down to the nerve receptors. In anxiety, it stops your brain from releasing the chemicals which makes you feel anxious. So the mode of action is basically peripheral as well as the spinal level as well as on the brain level. In context of neuropathic pain, the pregabalin is approved for various conditions such as diabetic polyneuropathy, post-herpetic neuralgia, and which is a pain which is very commonly seen in post-herpetic shingles, and the fibromyalgia. It is believed to work by reducing the hyperexcitability of the nerves and damping abnormal pain signals to the brain. So, pregabalin was approved in 2004 as a treatment of seizure as well as a pain management procedure. So there are various components which are available, and with their brands are very commonly available. And the Genix Pharma has launched as a C-pill, which is available in 50 milligram and 75 milligram and 100 milligram. So as a national company, because of the price and because of the availability in Pakistan as well as in the small towns, it can be used as a by the name of C-pill. Otherwise, we have a lot of pregabalins which are available by the various pharmaceutical companies. The Genix has a molecule which is available as a name of C-pill. The treatment of uh, it was approved in diabetic peripheral neuropathy as a pain management. It was also approved as a pain management syndromes in spinal cord injuries, especially those who have a traumatic spinal cord injuries, those who have uh, myelitis, those who have a multiple sclerosis, those who have a cord compression because of the degenerative spine. Neuropathic pain is originating from the post-herpetic neuralgia is very common, and it can present with a severe pain. So it can be indicated in neuropathic pain. Sometimes people with the unknown fibromyalgic pains, they can present with you in the clinic, especially in the female population. So we have used this medication, and I have tried in fibromyalgia. It has a very good mode of action. It relieves the fibromyalgic pain. It can be used as a adjuvant therapy to the epileptic patient as an anti-seizure medication, which have partial onset or generalized onset. So off-label uses are generalized anxiety disorder, social anxiety. Sometimes it is used as a bipolar disorder, as a mood stabilizer. It can be used in various types of insomnias. It can be used in chronic pain conditions. And it has a slight action on the chronic pruritus because it blocks the nerve roots and receptors. Sometimes it is also used as an anti-coughing medication. And the restless leg syndrome is a very common condition which is underdiagnosed. It can be used in restless leg syndrome in small doses. So the mechanism of action as a anxiolytis is exerts is a through the binding to the alpha 2 delta subunit voltage gated calcium channels. It works by binding to the alpha 2 delta subunits of voltage gated channels in the central nervous system, which helps to reduce the release of certain neurotransmitters involved in anxiety. For anxiety disorder, pregabalin is approved for treatment of generalized anxiety and social disorder, but this is off level. The FDA has not approved yet. The efficacy and the clinical studies which present the key demonstrating the efficacy in the treatment of anxiety disorder are that dosage are 150 milligram per day in two divided are three doses. It can be maximized to the 600 milligram per day. In social anxiety, it can be given 75 milligram at bedtime. It can works very well. The common side effects and safety considerations are the side effects are dizziness, somnolence, fatigue, confusion, difficulty in concentrating, memory impairment, and sometimes people can report pedal edema or swelling of the hands and feet and ankles, and it can increase the weight also. So the common which I have observed in the people who are taking high doses of pregabalin, they have a dizziness, they have a somnolence, they have a swelling of the feet, and they have a dry mouth. Sometimes it is nauseating also. If you use very high dose, it can lead to the abnormal visions like blurring of vision. So in our population, we have to start with very small doses per day, and then you have to escalate and you have to recall the patient for their side effect profile. When comparing the pregabalin with benzodiazepines, such as lorazepam or diazepam, there are several factors to consider. Pregabalin improves the treatment of generalized anxiety disorders, social anxiety disorder. It is a first line anti-anxiety medication. It can be used in panic disorders in small doses, especially the panic disorders in the females. And it can often have a longer anti-anxiety effectiveness, so it can be used. The side effect profile is the same. And the benzodiazepines has a very time-tested medications, but they can be used, but they are the habit forming, so one has to avoid. And they have a motor impairment, and they can lead to the cognitive impairment, and they can lead to the memory loss. While pregabalin cannot lead to the cognitive impairment, or it cannot lead to the memory loss. So benzodiazepine versus pregabalin is a safer medication when you use in patients in generalized anxiety disorders. It has a very magical role in neuropathic pain. It is defined as a pain arising as a direct consequence of the lesions or diseases affecting the somatosensory system. The somatosensory system starts in the receptors. Wherever in the hand, in the feet, the receptors are stimulated. So it can lead to the signals to the brain through three first order, second order, and third order neurons, and they can be relayed in the brain. So it is used as a painkiller or neuropathic pain subsider in especially the trigeminal neuralgia, diabetic pain, peripheral neuropathy, and the post-herpetic shingles. Shingle is very common. You see in this picture, there are dorsal shingles, which are shown in this picture. So neuropathic pain may often be suspected or identified through some of the classical description of the pain. That pain give rise to such as burning, shooting, tingling, electrical shock like. It can be a sharp like knife, nagging, walking on the hard or cold coals. एंड सम हमारे उर्दू में या सिंधी में लोग आके कहते हैं कि रात को मेरे जो तलवे हैं ना वो आग की तरह जल रहे होते हैं या खोलन होती है. The pain is often worse at night. They may be paroxysmal, they may be continuous, and this is a character sign of symptoms of hyperalgesia. So hyperalgesia is defined as an increased sensitivity to the pain stimulus like temperature, allodynia, and pain created by the stimulant that does not ordinarily produce pain. The application of the cotton swab, wearing of clothes, autonomic signs include the skin changes such as edema, shininess, and changes of respiration, motor in this. These are the neuropathic. Other than this, when you see lot of female patients, they come to you, they say, डॉक्टर साहब मेरे सर पे पानी गिरता है या मैं कंघा करती हूँ तो मुझे बहुत पेन होता है. This is called allodynia. So this is a very magical medication to use in allodynia along with the cervical spondylosis also. So patient belief there's perception of pain and its causes, coping strategy, mood changes, disturbed sleep, anxiety all lead to the generalized anxiety and depression in patient with the neuropathic pain. So neuropathic pain are sometimes very variable. So the mechanism of action of it is as act as an analgesic and it modulates the calcium channels activity. And the indications are again a repetition, neuropathy, fibromyalgia, and post-herpetic neuralgia. And sometimes I do combine with the pregabalin with the duloxetine, though they give very good results if you combine these two medications with them. Commonly used in lacosamide is a drug which has been used by the orthopedic surgeons as a painkiller, but it has a pregabalin has a superior efficacy and they reduce the intensity and they improve the sleep and the functional outcome of the patient with pregabalin. So again, the dosing is very important. If you suspect this is a neuropathic pain, you have to start with the 50 milligram. It can go up to the 100 milligram BD, RTID. I usually use 50 milligram 8 night initially for 3 days, followed by 50 milligram incremental dose for next 1 week, and then followed by 75 milligram AM and PM because patient get tolerance to the medication. But in post-herpetic neuralgia, the pain severity is very high, so you can start with the 150 milligram. twice a day. Adult dose in fibromyalgia, I usually start with the 50 milligram daily and slowly I escalate and combine with the duloxetine 20 milligram. That gives you a very good result. So in epilepsy, the initial dose is as an anti-seizure is a 150 milligram per day into 2 or 3 divided doses you can use. And it can be increased slowly by escalating the dose up to the 600 milligram per day. There are some pediatric doses, and this pediatric doses I have never used in pediatric population. But after reading this slide, I will start pediatric population. It can be used in patient with up to the 4 years of age, and the kilogram weight is important. The 17 years and up to the older, it can be used also. So I have never used in pediatric population, but after reading this slide, I will try my level best to use in the pediatric population. So there are two guidelines. The American Diabetic Association guideline, ADA's standard medical care in diabetes, provides recommendation for the management of the diabetes related to the complication, including the neuropathy. While the guidelines do not specifically mention pregabalin, they recommend considering medications such as pregabalin, gabapentin, duloxetine for the treatment of painful diabetic neuropathy. The choice of medication should be individualized and based on the patient's weight, age, sex, and the characteristics and the preference. The European Federation of Neurological Societies published a guideline for the pharmacological treatment of the neuropathic pain, which includes recommendation of diabetic neuropathy. The guidelines suggest considering pregabalin as a first-line treatment of neuropathic pain, including diabetic neuropathy. However, it is important to note that these guidelines are non-specific to the diabetes and cover the broader range of the neuropathic conditions, like so many conditions of the pain syndrome. Thank you so much. These are the few packets which are shown by the Genix Pharma, and they are available in the 50 milligram, 75 milligram, and 100 milligram. I'm happy to take the questions. Thank you.
Thank you so much, sir, for such nice presentation. Hope, just like me, all doctors and participants enjoy this session. Doctor, what is the duration of pregabalin, dosage of pregabalin?
The duration depends upon the patient's condition and the symptomatology of the patients. So if you start with the lower doses, 50 milligram at night, followed by escalation slowly, you can go up to the 3 months in patient with the generalized anxiety disorders. But you see the chronic painful condition of diabetic neuropathy is a chronic condition. So you can use this medication for a prolonged period with safer in lower doses. You can keep on them lower doses up to the 6 months to 1 year.
Sir, have you used pregabalin in epilepsy patients, and what the seizure type it works well?
I have used this pregabalin in anti-epileptic medication where there is a resistant or refractory epilepsy, and those who have focal in onset followed by generalized tonic-clonic seizures, I have used in combination with the other medications like sodium valproate and carbamazepine in additional to the pregabalin. So it has a very comprehensive and good role.
Sir, it can be prescribed with any other antidepressant. Which antidepressant is suitable for use with CYPL?
I think this is a useful medication you can use with the sertraline, and sertraline goes very well with this medication. And you give sertraline in a smaller doses. Initially, you start with the 50 milligram, followed by 50 milligram of pregabalin at night, and sertraline should be given in the morning. So you have to go up to the 1 month very slowly. And if patient gets tolerated and if patient does not have a side effect, then you can escalate the pregabalin up to 100 milligram and sertraline to the 100 milligram. You see depression and anxiety These are the very recurrent episodic, and they have a bipolar disorders. They have a part of depression as well as the mood instability. So they can be used very prolonged period. So I have no doubt about using this pregabalin medication, but you have to keep in mind the side effect profile, the tolerance, and the availability and the cost of the medications.
Sir, Dr. Suzanne asked, in anxiety, what is the minimum effective dose and how much time one should have to take for anxiety according to Maudsley guidelines? Thanks.
The guideline says 50 milligram is enough. Up to 75 milligram per day, you can use this as an anti-anxiety medication, and you have to monitor and titrate the symptomatology as well as the tolerability of the medication. If somebody who's stable on the 50 milligram and his symptoms or her symptoms are very well controlled, you can go up to the the 3 months, followed by you can have a follow-ups and the anxiety level checkup.
Sir, what is the benefit of pregabalin over lacosamide considering treating neuropathic pain?
Honestly speaking, I have doubts as a property of lacosamide as a painkiller. But lacosamide is very good medication for anti-epilepsy or anti-seizure medication. I do not find this lacosamide as a very effective pain or neuropathic pain management. मेरा तो कोई यकीन नहीं है इस पर. Pregabalin, I use gabapentin and pregabalin and duloxetine in pain management.
Thank you so much, sir, for your time. And sir, another question: can we give pregabalin with an antidepressant because of sedation in pregabalin?
I told you sertraline के साथ हम use कर सकते.
Thank you so much, sir, for your time and for your wonderful presentation. Thank you, sir.
I am happy to take the question. If somebody who is asking you, then you can share me. I will happy to answer them.
Thank you so much,
And
sir.
thank you very much. Thank you very much, Asim, Akil, and Kazmi Saab for sponsoring the educational activity in the on the platform, the JNX, because we as a educators, we as a trainers, we as a uh, advocate of educations, we are happy to take the questions and happy to share experiences with the public. And this program is a train the trainers program of Genix. Thank you very much.
Thank you so much, sir. Thank you.